Hi there guys, welcome back. Today we're going to be looking at the differences between normal breathing and abnormal breathing. So don't forget to watch it all the way to the end, and please hit the subscribe button and also the notification bell so you don't miss out on any of our videos that we release weekly for you. In today's video I want to look at what normal breathing is in comparison to abnormal breathing, agonal gasps. And the reason I want to talk to you about this is because in my role as an emergency responder with the ambulance service, I have recently seen a lot of unconscious casualties who have been having agonal gasps, but the people that are with them haven't recognised that, and therefore they haven't had the medical help when they need it most. So what I want you to do now is just look at somebody else that you've got in the room or the house with you. If you haven't, just look at yourself. It's really important to recognise what normal breathing is, what it sounds like, what it feels like, what it looks like. Because we breathe between 12 and 20 times in a minute if we're breathing normally, which is 2 to 4 times in 10 seconds. And it's so important to recognise what normal breathing is, so we can actually see when someone isn't breathing normally. Because remember, in an unresponsive patient, someone who can't wake up, and they are not breathing normally, they're having agonal gasps, remember, not affected breaths, and therefore they're in cardiac arrest, they are likely dying. And without your help, they are not going to recover into the full capacity they were before that started. Okay, so let's just recap. If we find someone unconscious on the floor, what we must do is open their airway, and we must look, listen and feel for normal breathing. And we must do that for 10 seconds because we're looking for at least 2 breaths. And if they're not breathing normally, we must call the ambulance and we must begin CPR. So let's have a look at what agonal gasps are, because unfortunately, agonal breathing or agonal gasps, they get mistaken for someone who is moaning or maybe fighting for a breath and is still sort of breathing, albeit not normally. And this is so not true. Agonal breaths are just a reflex action of the lungs or impulses from the brain trying to get oxygen. It is not normal breathing. I repeat, it is not normal breathing. What we are doing right now is breathing normally. Agonal gasps are involuntary and insufficient respirations that are caused by low oxygen in the blood, also known as hypoxia. This breathing is not normal breathing, and it does indicate that someone is likely dying in cardiac arrest and needs your emergency help. Agonal breaths can be associated with someone as well that shakes or maybe other muscle movements due to the fact that they're struggling for that oxygen, but they are not normal breathing. They need your help now. Because a person who experiences agonal respiration, they might stay alive for about 5 minutes, but there is a possibility to revive that person after that. But according to science and lots of research has been done, within 5 minutes of oxygen depletion, your brain cells will begin to die. And in fact, within 10 minutes, sufficient organ and brain damage may have occurred. In an unresponsive patient, someone who can't wake up, and they are not breathing normally, they're having agonal gasps, remember, not affected breaths, then we need to begin CPR. And remember, it might sound like they're gasping, but it could also sound like they're snoring, snorting, and also have laboured breathing. It may seem as the person is also moaning or moving a little bit, but it is not normal. You must call for help immediately if you suspect someone is experiencing agonal breaths. And you must perform CPR until help arrives to make sure they have enough oxygen going to their vital organs and their brain cells, so when the emergency services do arrive, there is a better chance of survival. I'll leave links above for you and also in the description below so you actually know how to perform CPR. Don't forget to hit subscribe and also hit that notification bell so you don't miss out on any of our important videos. Thanks guys.